All right, so we have a lovely patient who is having a revision breast surgery. We did her initial surgery, and actually she had a breast reduction years and years ago as a teenager, a couple of years ago, no, many years ago. And she was very happy with that result, but then she found that she was too small and she wanted to add some volume, so we decided to put implants in, which is not unusual because patients sometimes many years after a breast reduction they can decide that they want to redo the reduction. Things happen, pregnancies, weight shifting, and in this case there was no pregnancy. The weight, not much of a change, but our patient just decided that she wanted to have some volume, so we put in implants and we did a lift and implants, and we did the surgery a while back. And initially the right breast was sitting much too high. It is a slightly larger implant, and the left side is a slightly smaller implant. It looked like we needed that on the table, but this one kind of took a while to drop. This one took less time to drop. And now with dropping, you can see that this implant is still sitting a little bit higher. This one's sitting a little bit lower. We also utilized her areolar incision and the vertical the first time on the right side. And on the left side, we just used the bottom. And so we want to tighten this breast up a little bit more to get it to match. So we're going to work on trying to get them as even as possible. We're going to try to get both implants to sit about this high, and we're going to use Galaflex, which is an absorbable mesh, to support the breast and keep it high. She has implants in the 400 cc range, which are quite full, and they're heavy implants, and so they need that extra support in order to prevent that from happening again. So right now we're just going to get some more measurements. You're going to see that her left side is sitting at about 21.5, and her right side is sitting at about 21. The areola on the left side, we've shrunk that down a little bit. That's 5 by 7. And the one on the right is a little wider, 6 by 6. So we're going to make this a little bit smaller to get it to match that one. In fact, do you think that we should try to reduce this one a little bit to the areola is small? Okay. So what we're going to try to do is we're going to try to get both areolas a little bit smaller. So what we do is we do this, we do that, we do this, we do that, and then we can try to get it down to more in the 4 to 5 centimeter range. So we're going to try to shrink it down a little bit. And of course, when you have a large implant in, it pushes on the areola, so it does stretch it, but we'll try to get them a little bit smaller. And so that's what we're going to do with that. And she's sitting at 11, so that's good. This one's actually going to come in a little bit because we're going to be taking more from there. So what we're going to do is we're just going to estimate, just want to make sure she has good mobility, good mobility, good mobility. So we're going to try to get a little more cleavage and a little more upper fullness. We're just going to mark in our scar. Here's the previous scar. And we're going to use what we need to of the scar in order to accomplish what we need to accomplish. And for this side, we're going to narrow her just a little bit, and maybe a little more narrowing on this side. So we're probably going to come down a bit like that, a bit like that, and a little bit more on this side, a little bit more on this side to bring things together and bring her up higher. And then we'll be supporting the bottom of the breast with the Galaflex. So the Galaflex is going to come in here and support the bottom of the breast to keep the breast up higher. And the same on this side. So the result will be something more like that. You want to look for a second in the mirror. You like that height like that? Okay, get them to be more even higher, higher still?
There.
Okay, even there? Okay, good. Okay, excellent. Put your arms up over your head for me. And put them down. Okay. And I just flex your muscles for me. Good, relax. Okay, so you see a little bit of muscle, a dynamic muscle activity. They are under the muscle. The muscle's really pretty much covering just the upper part, which is typical. The lower part is covered by her breast tissue. And that's it. So tomorrow's the day, and we'll proceed then, and we'll show some follow-up pictures eventually. Thank you for your attention.